All right. Thank you, everyone, for joining. My name is Sean Ford with Dr. Fossum's Pet Care. We have Dr. Terry Fossum, the founder of Dr. Fossum's Pet Care, and Dr. Matthew Miller, a canine cardiac veterinarian. So I'll let Dr. Fossum do a more proper introduction there. But before we get started, this webinar is being recorded. So if you do not want to be recorded, you can certainly just listen in, or feel free to drop off at any time. If you have any questions, please put them in the chat, and Dr. Miller will do his best to get to answer any of them at the second half. So the format today will be the first 30 minutes will be prepared remarks by Dr. Matt Miller, and then the second half will be a question and answer, where we'll answer any questions that you have. So that's Dr. Fossum. Would you like to introduce Dr. Miller?
Yes. Hi, everyone. Thank you for joining today. So it is my distinct pleasure to introduce Dr. Matt Miller. Matt is a diplomat at the American College of Veterinary Internal Medicine and Cardiology. He did his veterinary school and residency at The Ohio State University, and then spent 26 years on the faculty at Texas A&M. He is now in private practice doing just cardiology in Scottsdale, Arizona. And with that, Matt, I will let you take it away.
That's great. Hey, thanks for the introduction, and thanks for the opportunity to come and speak today. When I've done webinars in the past, one of the comments always is, well, that turned into a lecture and I never got to ask my questions. And so I'm going to do my very best to get through some basics of canine cardiac care, and then leave it open for questions. And I've purposely left quite a bit of time at the end so that we can really try and drill down to people's specific questions. Hopefully they'll be limited to cardiology, because that's sort of what I do for a living. But I'm open to trying to answer any questions that I think are appropriate, or I'll direct you into the right spot. Okay. So with that being said, let's go ahead and get started. I assume you guys can see my slides. Is that correct? Awesome. Okay. So I entitled this Canine Cardiac Care, What Pet Owners Need to Know. What I'm trying to do with this presentation is take away some of the mystery of cardiac disease, at least in our canine patients. Talk a little bit about what the causes are, what we can do about it, and then try and address some of the questions that come up really frequently to me. And that's one of the reasons that I've set this seminar up in the way that I have. So let's go ahead and get started. There you go. Okay, so when people ask me, when I talk about canine heart disease, I say, well, what do dogs really get? Okay, so most of us are familiar with the diseases that afflict us or our loved ones, mostly coronary artery disease. Many of us have family members that may be dealing with cardiac disease. And dogs get some similar cardiac diseases, but not really the same ones. So frequently I'm asked, well, is my dog going to have a heart attack? Well, the answer to that is no. Your dog can get heart disease, and your dog can get heart diseases that are similar to what we see in people, but typically they get different things. And what I'm going to try and do is concentrate on the 2 to 3 most common abnormalities that we see in dogs. And so if you blow up a little bit of a pie chart and you look at canine heart disease, first of all, you look at the basic epidemiology. It's been estimated that nearly 8 million dogs in the United States suffer from heart disease. And there are studies that suggest that between 3 and 3.5 million dogs are diagnosed annually with heart disease. So let's take a step back. Heart disease does not equal heart failure. And that seems like, oh, that's a really simple concept. Well, it's really not, because of all the dogs that develop heart disease, less than 1 in 3 of them probably ever go on to develop heart failure. So it's a very important differentiation. And many times people receive a diagnosis in their dog of heart disease, and they immediately think, well, my dog's going to die from this soon. And they interact with them differently. They handle them differently. And it's really important to recognize that you can have heart disease and not have heart failure. And you can have heart disease and subsequently succumb to some other disease process. As cardiologists, we oftentimes say we want to diagnose disease as early as we can and change the course of it the best we can. And our job is to manage it well enough that our patients succumb to some other disease. Unfortunately, that's not always the case. So let's look at the diseases that we see in dogs with cardiac disease. You can see this huge section, that's valvular heart disease. That's typically a disease of small breed dogs. And we'll talk about who's at risk and who's not necessarily at risk in just a second. By far and away, the most common cause of cardiac disease in the dog. Very easy to diagnose. We'll talk a little bit about how it's going to be diagnosed. We're going to exclude heartworm disease because that's a totally different description in and of itself. We're also going to talk about dilated cardiomyopathy. I want to point this out probably because it's the most common disease that we see in large breed dogs. We'll talk a little bit about what breeds and what size dogs are predisposed to things as we move through this. And it'll open up the discussion, which is oftentimes heated, very controversial, is the nutritional aspect of heart disease. Does nutrition cause it? Can it fix it, et cetera? And I'll try and address that. Although again, you could do a multiple hour webinar on what we know and what we don't know about diet. Pericardial disease is a disease of the sac around the heart, pretty infrequently seen. And again, we're not going to address that in this presentation. And then the final segment you see is congenital heart disease. Those are obviously abnormalities that patients are born with. Many of those we can take care of. We don't see the really complex ones that we see in people, primarily because those puppies probably succumb to that disease before they're evaluated. And so we're not going to talk about congenital disease. So what does that leave us with? Chronic mitral valve disease and dilated cardiomyopathy, or a form of primary heart muscle disease. Whenever you see cardio and myopathy together, think about heart muscle. And when you see valve, think about abnormalities of the valve, usually degeneration, rarely, very rarely, infections associated with that. So we're going to direct this presentation to chronic mitral valve disease and dilated cardiomyopathy. So I want to give you an overview of sort of what we're going to try to address here. And up in the upper right corner, that's just a video showing a heart opened up from sort of top to bottom. This is courtesy of SIVA. And these are the atria. And the reason I'm pointing this out, a little bit of anatomy up here, is I'm going to talk a little bit about when your atrium gets big, your ventricle gets big, things like that. So here we see the atria, they're normal size. These are that's the mitral and the tricuspid valve. Mitral valve is one that's commonly affected. And so we're going to see a little video when it's abnormal. Blood comes in, goes out, nothing goes backwards, right? The other thing you can see is this heart is moving pretty vigorously. I'm going to show you a couple diagnostic images. I'm not going to try to make you a cardiologist by the end of this 30-minute presentation, but I'm going to try and give you a little perspective on what we utilize as primary care clinicians and cardiologists to try and not only make the diagnosis of heart disease, but also get a really good handle on how important that disease is. Because the more important the disease or the more substantial the disease, the more likely we're going to be able to intervene in that. So what types of cardiac disease do dogs get? That's what we're going to talk about. We've talked about it briefly in that little pie chart. I'm going to answer hopefully the question, is my dog at risk for heart disease? And of course, every living creature theoretically is at risk for heart disease, but there are specific breeds and sizes of dogs that are at much higher risk than others. And there's some known mutations for some specific breeds that we'll mention at least in passing, because it's another way we can be proactive in evaluating our patients for cardiac disease. We're going to go over the most common signs of heart disease. Some of you on the webinar are probably interested. Well, what should I watch for my dog if I'm concerned about my dog, or my dog is an at-risk breed that you've described to me? What do I look for? What should prompt me to go to my veterinarian and talk to them about it? I'll talk about how heart disease is diagnosed. And once again, we're not going to go into an elaborate discussion of diagnostic testing, but I think it's important for you as pet owners to know what kind of diagnostics are going to be recommended to me. What are those tests going to tell me? Can heart disease be treated? We'll talk about some of the therapies and medical therapies that are available, and some of the, I would argue, newer alternative therapies that that are coming down the pike as well. We'll briefly talk about what role diet plays in heart disease. Once again, I don't want to get into the weeds. I'm not a veterinary nutritionist by any stretch of the imagination, but I'll give you a sort of some take-home points about diet that hopefully will be helpful when you decide what you're going to feed your dog. And then, can I prevent heart disease in my dog? Are there any things that steps that we can take to change the course of the disease, change the likelihood, or if nothing else, to try to promote optimal cardiac health, make sure that our dogs are getting what they need to optimize their cardiac health. This is just one of my favorite patients, Waldo, who did have valvular heart disease. One of the things you'll see, he's a little dog, and he always had this mohawk, oftentimes with quite a bit of product in it. And he's sort of a quintessential dog style for valvular heart disease, which we'll talk about in just a second. All right. So what types of cardiac disease do dogs get? The number one, by far and away, if you remember that, that pie chart we showed you, valvular heart disease. It's typically a disease of small breed dogs. Large breed dogs can get it, but it's much, much more common in small breed dogs. That is typically defined by, if you can recall the video I showed you before, now this valve is really thickened as compared to this tricuspid valve, which looks pristine. You can see this little orange flow back. That's to show you the regurgitation. Okay, so you'll hear mitral insufficiency or mitral regurgitation. It's the same exact disease process. What it means is that valve is no longer competent. And when that valve is no longer competent, blood flows backwards. When it flows backwards, there's an extra load on the heart. The heart has to do extra work, and then the heart sometimes ultimately fails. Primary heart muscle disease. This is a disease we see almost exclusively in large breed dogs. This is the disease that those of you that maybe were on the webinar to talk about diet, this is the disease that we see associated with some of the dietary issues that have been identified. And this is just an echocardiogram. We'll talk a little bit about echocardiography as a diagnostic test in a second. But to give you an idea, this is the main pumping chamber of the heart. And that area, that black area here, is where the blood is. And that should be changing by about 50 to 55%. So you can see that this dog has tremendous dysfunction of his heart muscle. And then the third one I think that we should include are rhythm abnormalities. And some of these rhythm abnormalities are secondary to valvular heart disease or primary heart muscle disease. But those of you who love boxers know that boxers are predisposed to a primary rhythm abnormality where their heart muscle is fine and their valves are fine, but they have rhythm abnormalities that can be fatal, can be managed, can be fatal. And we actually have screening tests for those dogs that we can look and see if they're highly predisposed or not. All right. So the big question, is my dog at risk for heart disease? I wish I could say no. I mean, every dog is potentially at risk for heart disease. There are breeds that are highly predisposed. So you just have to assume that no matter what breed you have, those of you on the call that are doodle lovers, the doodles are a breed that we see everything in. So, you know, you always hope when you have the old hybrid vigor, right? I'm going to put two breeds together and they're not going to get anybody's disease. So they get everybody's disease. So we see valve disease in those dogs, and we see primary myocardial disease. Some of the doodles also, because they're golden doodles, are probably more sensitive to some of the dietary issues that we'll at least touch on at the bottom. Okay, so who are the breeds that we're talking about? So any small breed dog, any dog that's under 20 pounds is probably at risk for valvular heart disease. We oftentimes say the more tubular they are, the more short their legs are, the more crooked their legs are, the more they're predisposed to that disease process. Cavalier King Charles Spaniel are the quintessential breed. It's very uncommon to listen to an 8 or 10-year-old Cavalier and not hear a murmur. Dilated cardiomyopathy. The classic breed is a Doberman Pinscher. We're seeing a little bit of a reduction in the incidence in that breed, primarily because we now have genetic screening that many breeders are using routinely to try and diminish the problem in that breed. And then remember we talked about rhythm abnormalities. Well, boxer dogs are the classic breed for rhythm abnormalities. Once again, there is genetic testing to try and determine whether or not your dog is at very high risk. And many times people ask, well, why should I do genetic testing in my dog? My dog is neutered. We're not going to breed your dog. The information you get from genetic testing gives you a very good level of confidence whether or not your dog is at high risk for development of clinically relevant disease. And also helps us as cardiologists make recommendations to you regarding serial evaluations, et cetera. All right, so we know everybody's predisposed, okay? Everybody's at least at risk. We know the breeds that are predisposed, small breed dogs to valvular disease, large breed dogs, especially the giant breed dogs, like Great Danes, for example, are predisposed to primary myocardial disease. We know that boxer dogs are at increased risk for rhythm abnormalities and sometimes fatal rhythm abnormalities. So the question is, what are the most common signs of heart disease? Now, remember that most dogs with heart disease without heart failure are not symptomatic. But if you have symptomatic heart disease or heart failure, what's the most likely symptom that you can expect? Well, especially in small breed dogs, cough is by far and away the most common presenting complaint. This is a chest x-ray looking at the dog from the side. We'll talk a little bit more about what we find on these in a second, okay? But this dog's heart is big. This is the trachea right here. It should be down here. This dog's heart's big. One of his chambers is really big, the atrium. Remember we talked about that. And this dog has a little bit of infiltrate in its lung, probably heart failure, pulmonary edema. You'll hear that term frequently. Some of these dogs are just short of breath as they have fluid accumulating in their lungs or they have decreased forward cardiac output. They may have exercise intolerance. We seem to see that more frequently in dogs with primary heart muscle disease, but those of you that have small breed dogs that are very active, especially some of the coursing breeds or some of the agility breeds, oftentimes we're brought in, these animals are brought in because their exercise tolerance is going down. Some of these dogs will collapse. They almost look like they've died. They have what they call a cardiac faint, or you'll also hear the term syncope used. That's usually associated with advanced disease that usually occurs in dogs that have been managed for a while anyway. And then sudden cardiac death can be really, really devastating because that occurs in dogs oftentimes that don't have any premonitory signs. This is a arrhythmia. This is an ECG of a boxer dog with a very, very bad ventricular arrhythmia. And that's what happens to some boxer dogs. Sometimes their only presenting signs is that they died suddenly in the backyard with no premonitory signs. It's one of the reasons that if you have a boxer dog, getting him in to be evaluated, maybe even thinking about genetic testing in them will give you an idea of whether or not your boxer dog, and even it's not just purebred boxers. We see a lot of boxer dogs and pit mixes that are afflicted with really nasty ventricular arrhythmias. So most common signs? Yes.
So what do people do when their dog is in that collapse category, has a sudden cardiac event? Is there anything that they should do in particular?
Well, unfortunately, especially with the boxer dogs, there's nothing you can do. That's that would be like a person dropping in the grocery store. If you don't have a defibrillator there, they're not going to probably make it out of the grocery store. In dogs that have collapse, that have chronic heart disease, most of those dogs are collapsing just because their disease has progressed. And most of those dogs will actually wake up from those events. There's really not much you can do other than seek veterinary care as quickly as you can, unfortunately.
Thank you.
So how's heart disease diagnosed? Most heart disease, especially valvular heart disease, is diagnosed by physical examination. Many of you on this call probably have a dog that has a murmur, and that might be why you're on this call right now. That's usually based on careful physical examination. Yet another reason to have a veterinarian evaluate your dog at least yearly, if not bi-yearly, especially once they hit past 8 to 10 years of age. 10 years of age is probably the average. 10 to 12 is the average onset of valvular heart disease. Some dogs are diagnosed based on clinical signs. We just reviewed those: cough, shortness of breath, exercise intolerance, or collapse. And any of those signs should prompt you to get your dog evaluated. So there's blood testing. So how do we use blood testing? There's really two major forms of blood testing. There are biomarkers, and those are blood tests that elevate as heart disease progresses. Contrast that with genetic markers. In genetic markers, there's only a few genetic markers identified in dogs, in boxer dogs and in Doberman Pinschers. There's some other ones they're looking at, Rhodesian Ridgebacks and other breeds as well. Chest x-rays. Chest x-rays play a critical role in evaluation of dogs with suspected heart disease, as they give an idea of whether or not the heart is enlarged. And that can be a very useful diagnostic testing, especially diagnostic test from a screening standpoint. So many times, if a veterinarian hears a murmur based on physical examination, the first thing that they'll request is, let's get a chest x-ray. Because if the heart is big on chest x-rays, those dogs probably need more diagnostic testing to try and categorize them. Even if they're asymptomatic, you can have important heart disease and be asymptomatic. And the reason that's important to look at is that there are very good studies to show that we can change the course of their disease. Echocardiography, also called cardiac ultrasound. That is the next diagnostic step that is usually taken. Here we see an example of a dog with very bad valvular heart disease. The left atrium is really big. So echocardiography is not only anatomic, but it's also functional. It allows us to look at heart muscle function. And with the equipment we have now, we can look at the flow within the heart, see if we have regurgitation. We can calculate pressures inside the heart. We can drive an entire, basically, pressure profile in dogs non-invasively. That's basically what I do all day. Is I do cardiac ultrasound on dogs and cats, of course. And then electrocardiography. Electrocardiography, we've shown you examples of ECGs, EKGs. That's the other terms that'll be utilized for this. And that is usually indicated when an arrhythmia is picked up on physical examination. And so, once again, careful physical examination by your primary care veterinarian is going to be really, really important as the first screening test for heart disease. Just because your dog doesn't have a murmur, just because your dog doesn't have a rhythm abnormality picked up, doesn't mean your dog doesn't have heart disease, but it makes the likelihood of that heart disease very, very low. And probably doesn't warrant additional diagnostics unless there's some other concerning factor like clinical signs. So of course, then it's like, well, why do I diagnose this? Who cares if I diagnose it if I can't do anything about it? Well, we actually can do something. The question is, can it be treated? If you pose the question that way, the question is yes. Can it be cured? The answer to that is almost never. Unless you're talking about congenital disease, or whether you have the wherewithal to do definitive repair. So if your dog has valvular heart disease, you can fly your dog to England, or you can fly your dog to Japan, and hopefully pretty soon you'll be able to just fly him to Florida and get their valve definitively repaired, just like they would for you or I. But that's usually outside the realm for most people. And so we usually break therapy into medical therapy and interventional therapy. And then for medical therapy, we break it down even further. Cardioprotection. What we're trying to do is slow the progression of disease. And the only drug that's been shown to slow the progression of disease is a drug called Vetmedin. And we're not going to get into ins and outs of heart failure therapy, but this is a drug that you'll see probably recommended if your dog has cardiac enlargement and a loud murmur. And it is one of the only drugs that actually the only drug that's been shown to slow the progression of heart disease, both myocardial disease and valvular disease. So it's really been a game changer, at least for us as cardiologists. And then directed therapy. So directed therapy is when we're specifically treating a clinical sign or a finding. Okay, so that is really when you're looking at dogs going into heart failure. So once dogs have gone into heart failure, we use a lot of combination of drugs. We use diuretics, and again, not going to go into the in-depth of all the diuretics that we have, but we have several different diuretics, 3, sometimes 4 diuretics in the same patient. We have a new drug called Cardalis that uses a combination of both a diuretic and what's called an ACE inhibitor. ACE inhibitors used commonly in people for hypertension, mostly in dogs used for heart failure. And then, of course, once you're in heart failure, you're going to be on Vetmedin as well. Vetmedin increases the contractility of your heart. It also opens the vessels to the body, makes it easier for your heart to pump, which decreases the amount of blood that goes back across your mitral valve. And then Colorado recently started a program where they use a modified approach to the mitral valve, and they actually clip the mitral valves together through a small incision in the very apex of the ventricle. That's what we refer to as interventional palliative therapy. You'll also see this referred as a TEER procedure, TEER, and you can look that up. Colorado's got some good information on their website about it. And there are also interventional catheterization procedures where we literally poke a hole in between the 2 upper chambers of the heart to allow some of the pressure to fall off into the right side. So you can see once we diagnose heart disease, we can manage it pretty well, but typically can't cure it. All right, what role does diet play in heart disease? The simple answer is uncertain. The big discussion recently has been on grain-free diets, and I think many of us, if not all of us, wish it had never been associated with grain-free diets, because everybody looked at every grain-free diet and then said, oh, these are horrible diets, get your dog off grain-free diets. There are a bunch of grain-free diets that are very high quality. There are many dogs that are on grain-free diets because of GI or skin manifestations of intolerance of some of the ingredients that has literally been life-changing for those dogs and owners. So rather than thinking about grain-free diets, most of the most recent data, and this is a scientific report in Nature, so very high quality publication journals that are looking at what's referred to as pulses, and I'll bring it up here, okay? A high proportion of peas, lentils, or other legume seeds, pulses, and or potatoes in various forms as main ingredients, listed typically within the first 10 ingredients, anything before the vitamins and the minerals, okay? So if you wanna look at other sources that talk about diet, WASAVA, and this is just their website. It's a World Small Animal Veterinary Association, has some very specific guidelines for quality diets. This is the website to the FDA, that FDA is looking into this. And it's a very controversial subject right now. And I think we still have a lot of information to know. It's like so many times we thought we're super smart. We figured this out. It's taurine. It's grain-free diets. And the more you look, the more you figure out, you know what, it's way more complicated than that. And again, it's a subject that many people are extremely passionate about. It's a very polarizing subject as well, to the point of many lawsuits, et cetera. But I mean, when I talk to my clients, I say, if your dog likes his food, poops twice a day, and they look really good, and he doesn't scratch, then look at your diet. If it doesn't have legumes, potatoes, et cetera, in the first 5 to 10 ingredients, keep feeding it. Okay. Low sodium diets. Low sodium diets are utilized typically only in patients that have active heart failure or controlled heart failure. I'm not a big fan of severely sodium restricted diets. I'm a big fan of getting dogs to continue to eat what they like to eat. And so although low sodium diets play a role in heart disease, and well, really in heart failure, if your dog doesn't tolerate a low sodium diet, all is not lost. We can get around that. And there is, in my opinion, no indication for a low sodium diet in dogs prior to the onset of congestive heart failure. Okay, so we're going to finish up with the last two or three slides. Can I prevent heart disease in my dog? There's no definitive answer that the data that you can do that. We know that when dogs develop important valvular heart disease and their heart gets big, that we can change the course of that disease with vetmetin. But we didn't really prevent heart disease. We just altered the course of that disease. I think everybody agrees that keeping your dog really active, maintaining a sort of a healthy mobility for him is going to be really important. We mentioned briefly diet, remembering that at least based on what is known for diet in dogs with myocardial disease, you should probably stay away from the diets that have pulses in the first 5 to 10 ingredients, including potatoes. So that's just some way to look at it. Okay. And remember that exercise is a big way that we sort of stay in touch with our dog, right? And for some people, the only reason that they get out and do any exercise is take their dog for a walk, right? And so immediately saying, well, your dog has a murmur and therefore you should limit his exercise, there's no data to support that. And I would argue that maintaining good peripheral vascular health, et cetera, by exercise is going to be helpful for them. So can supplements make a difference? Once again, no definitive evidence that supplementation changes the incidence of disease. Okay, so what we're really trying to do, and when I look at supplements, what I really look at is, are these cardioactive supplements or cardiosupportive supplements? Okay, so what we want to do is we want to do everything we can to make sure that the contents of the diet and any supplements are promoting cardiac health. And so there are several different ingredients that have been shown to be important for cardiac health. Taurine was one of the first deficiencies, one that was documented in cats that led to dilated cardiomyopathy, prompted taurine supplementation in cat foods and essentially made that disease go away. Taurine deficiency has been associated with myocardial dysfunction in dogs as well. L-carnitine has been associated with cardiomyopathy and myocardial dysfunction in both people and in dogs. And it's oftentimes used to treat dilated cardiomyopathy, although it's not a therapy per se. What it's trying to do is promote cardiac energetics. L-arginine, it's an amino acid. It's a substrate for nitric oxide, and nitric oxide, also just referred to as NO, is really important in normal peripheral vascular function. And so if your vessels constrict and can't dilate like they should, then your heart has to work harder. The amount of regurgitation that you might see is going to be greater in dogs with poor vascular function. Omega-3 fatty acids, and especially green lip muscle oil, have substantial anti-inflammatory effects, can promote peripheral vascular function. So in combination with L-arginine, it's a nice combination. And there are studies in boxer dogs that have shown that omega-3 fatty acids reduce the number of ventricular premature complexes that they have, that arrhythmia that may be associated with clinical signs and even sudden cardiac death. Okay? NMN, or nicotinamide mononucleotide, is a coenzyme involved in a wide array of biochemical processes, especially mitochondrial health. I take it myself, and it's used primarily to try and promote cardiac energetics. So what you can see as we go down this list of ingredients, what we're really trying to do is we're trying to make sure that the substrate for normal vascular health, normal cardiac energetics, so energy formation, which leads to not only contraction, but relaxation of the heart, which is oftentimes overlooked, is really important. Coenzyme Q10 is an antioxidant. It's also thought, and there's many, at least cellular studies to prove it, that it can facilitate energy production in the heart. Probably not going to lead to elimination of heart failure signs, but if we can improve cardiac function by either vascular effects or energetics, that's all we're trying to do. Okay, and so when you're looking at a cardiac supplement, these are really the components that you're really looking for. The nicotinamide mononucleotide, I think, is a really important addition to this product, just from a mitochondrial function standpoint. This is just a list of those components of CardioCaps, and also the reasons that they've been placed into the production or the product. Now, one of the things that you'll notice on here is that none of these components are what we call cardioactive. And what I mean by that is there's nothing in here that causes diuresis. There's nothing in here that directly leads to increased contractility. It's all about supporting function, supporting energetics. And why is that important? Because there are a lot of supplements out there that have, quote, cardioactive substances in them. And especially if your dog has cardiac disease, especially if your dog is under care and receiving therapy, it's really important to avoid supplements that are cardioactive. And I'll just finish this with these, okay? On the left-hand side, beautiful plant, digitalis glycoside. Many of the supplements out there, you'll see that they'll have a digitalis component to it. And remember that digitalis, although can be therapeutic, has a very narrow therapeutic window, can lead to rhythm abnormalities, and can lead to other problems especially when administered with other products. So you have to be very careful about that. And on the right-hand screen, it's something you probably pulled out of your front yard sometime in your past, okay? It's dandelion. And you'll see many of the products that are listed as cardiac supplements have dandelion root in them. Well, dandelion root is cardioactive. It's, when given in high doses, can be a very potent diuretic. And remember, a diuretic leads to loss of fluid, can lead to electrolyte abnormalities. So be very careful when you look. And some of the code words are tonics, okay? So cardiac tonics oftentimes include digitalis glycosides or dandelion. So I would stay away from those, especially if your dog is already receiving cardiac disease. So I know I ran over a little bit there. I'd be more than happy to take questions about what I've presented or maybe what I didn't present and you wish I had presented, and I'll try and answer them as directly as I can. So thanks for attending, and I look forward to some interactions. So Sean, I think you're gonna bombard me with questions.
Yeah. So I did have some questions that a couple folks emailed me before that they wanted to talk about, and the first one is, what does a generalist veterinarian know about cardiac disease, and are they able to diagnose it, or when should I try and seek a specialist like yourself?
Okay, so a little, the answer to every question is it depends, right? It depends on that individual's interest in training in cardiology. Okay, so cardiology is a mandatory component of all veterinary curricula, but some people maintain a stronger interest in it than others do. If we're looking at it strictly from a screening, okay, so screening is hearing the murmur, recognizing the murmur, taking a chest X-ray, which basically everybody has access to, and then most people now are sending their chest X-rays out to a radiologist to be reviewed. So once they see that murmur, once they hear that murmur, especially see enlargement, then oftentimes they're going to refer you from that point. And so another thing that I should probably mention that's brought up by that is the intensity of the murmur. So people can get really caught up in the intensity of the murmur and say, well, it was we grade them out of 6, okay? And so somebody said, well, it was a 2 and now it's a 4, or it was a 4 and now it's a 3, so things are getting better. That's not true. We have to remember that murmur grade is very subjective, and it varies from clinician to clinician. What it tells us is your dog probably has a leak in its mitral valve. We should do other diagnostic tests. Probably the first diagnostic test to consider is the chest X-ray.
Cool. Thank you. And and when should I have my first visit to check my dog's heart for abnormalities?
That again depends on what breed we're talking about. So for example, Doberman Pinschers, we start looking at those dogs, especially if they have genetic mutations at 4 years of age. It's sort of a standard cutoff, okay? In small breed dogs that are predisposed to valve disease, and let's take it as a highly predisposed breed, so Havanese and Cavaliers. I'd want my dog listened to really closely by the time they're 8 years of age. That being said, cardiac auscultation, so listening to the chest, okay? We jokingly say there's a reason we wear our stethoscopes around our neck, is because we always want to have them with us, because we listen to every single animal we have the opportunity to listen to. And so I'm hopeful that your dog will have been evaluated at least yearly, if not more frequently, and somebody listened, and all it takes is a minute of listening, and you're going to be able to tell whether or not a patient has a murmur. But if your dog has never been seen by a veterinarian or never listened to by a veterinarian, if they're older than 8 and they weigh less than 20 pounds, you should get them in and get listened to.
Makes sense. And then the next question, this is kind of a Dr. Fossum / question for Dr. Matt Miller, but you have a survey on your website to help determine the severity of canine cognitive dysfunction. Is there a survey similar to that to understand the cardiac risk?
So I'll take a stab at that one. Okay.
Cool.
Cardiac risk is really based. There's a very high risk associated with specific breeds, and then if you take those breeds and then you listen to them, okay, that's going to be a pretty good screening for their relative risk of developing cardiac disease. So much, I'm unaware of any breed predisposition to cognitive dysfunction, but there are really strong breed predispositions to cardiac disease. And so whenever you would look at a survey, you'd have to look at it very closely for which breeds are in there, what ages are in there, because that could skew the results of that really, really dramatically.
Got it. Okay. And then I have 3 more questions that were emailed to me in advance, but if anybody else, I've actually given everybody the ability to unmute themselves to ask questions. So please keep yourself on mute. And then, after we get through these next 3 questions, feel free to unmute yourself, and hopefully we can take one by one to get some other questions answered. This one is, at what age would you recommend putting a dog on a supplement like a cardio cap?
So I would probably look at that as a middle-aged to older dog. Okay, so let's talk primarily about valvular heart disease. Okay, so with valvular heart disease, you figure their age of onset is 8 to 12, and so I would think about putting that 6 to 8 years of age. I think would be a reasonable time. There's nothing in that supplement that's going to be detrimental to younger dogs, but most of those younger dogs have pretty robust cardiovascular health. So if I had to pick a sort of a time, I'd say 6 years of age.
Got it. Great. And then is there any genetic testing something that is like an over the counter like service, or is that something that a person would get done in a veterinary office?
Okay, so there are services that provide it via cheek swab. The problem with cheek swabs is oftentimes they don't get enough DNA. So if you were to come to see me, what I would recommend is you submit a whole blood sample to North Carolina State University. They have a genetics lab. The dean at the veterinary school there is the person who found all these mutations. So her lab's been running these for decades as she moved along in her academic career. They've kept the cost very low to try and make sure that people do more and more screening from them. So if I wanted to, and remember, if you send in a sample and they don't have enough DNA, they still charge you to run the sample. Okay, so it's a simple blood draw. And if you have a dog that's predisposed, you have a Doberman Pinscher, you have a boxer dog. If there's any people on here that have cats, Maine Coons and Ragdolls, and now there's some interesting early data in Sphinx cats, they have diagnostic testing for them as well. So North Carolina State's where I would send it.
Fantastic. That's very helpful. And just on a personal note, I've taken one of those tests for cheek swab test for my dog, and they basically told me to swab my dog's mouth for like a minute or something like that. And there's no chance that I'm able to swab my dog's mouth for anything close to a minute. So, yeah, so that's a very interesting point on the cheek swab. And then the last question that was emailed in is in a perfect world, is there a food brand or product that you would recommend?
All right. Whenever you don't want to answer a question, you answer a different question. Okay. And so,
Okay.
So I'm going to answer the question, what do I feed my dogs? I have 2 Labradors. They both eat Royal Canin. I don't get any kickbacks from Royal Canin. They eat Royal Canin adult Labrador, and that's all they get. They get some treats, and I give them whipped cream in the morning, and I put it on my coffee. Okay, that's basically what they eat. And so, I would say stick with the bigger brands. That is not to say that some of the smaller brands don't put out some good quality products. But what I feed my dogs is Royal Canin and the breed specific one. So I bought it hook, line, and sinker, and I'm going to stick with that.
We'll give everybody a minute here to see if there's any questions. And while we're waiting, Dr. Miller, thank you so much for your time and taking this. Okay, so we have somebody from Madras Veterinary College in India.
Oh, nice.
Okay, can you please tell about DCM and HCM in dogs and cats?
Yes. So we talked a little bit about DCM. Okay, so DCM, also referred to as dilated cardiomyopathy. Dilated cardiomyopathy is seen much more commonly in dogs than it is in cats. But the disease behaves in a very similar manner, whether it's in dogs or cats. And the manifestation or the clinical appearance is the heart is dilated, the heart muscle function is reduced. That's the same in cats. Okay. Cats much more commonly get hypertrophic cardiomyopathy. Okay, so that's when the wall gets really thick. The heart muscle function, at least its contractility, is normal, but it gets inappropriately thick, and then it can't fill. Remember, when we were talking about energetics. One of the things we think about is, well, I want that heart to contract really vigorously. What people frequently forget is for it to relax is an active component as well. So theoretically, anything that improves energetics could improve diastolic function as well. Hypertrophic cardiomyopathy is very, very uncommon in the dog. So in my career, which I mean, it's been a long time, 40 years plus, is that I mean, I've probably seen 30 or 40 hypertrophic cardiomyopathy dogs in my entire career, and I will see 40 cats with hypertrophic cardiomyopathy every quarter of the year. And so it gives you an idea of how dramatically different they are. Management is relatively similar when you're dealing with hypertrophic versus dilated cardiomyopathy. The difference probably is that more commonly the pimobendan or the vetmedin that I mentioned is much more effective in dilated cardiomyopathy, although there's accumulating evidence that it might be effective in hypertrophic cardiomyopathy.
Awesome. Thank you.
Mm-hmm.
And then we have another question. Is there a particular supplement you would suggest? My dog has a heart murmur. I give him fish oil.
So, I mean, I would recommend he goes on CardioCaps, and the reason for that is you've already given him fish oil. Okay. One, it's pretty hard to give a dog too much fish oil. Although, so, I mean, some of the dogs that I have are being supplemented so much that literally when they're in the waiting room, you know they're there because they smell like the dock. They smell so fishy. And some of them are even like their hair coat is oily. And I guess that's too much. Okay. The reason I would look at a broader supplementation is that although you're addressing the anti-inflammatory components that you get with fish oil, you're not really addressing as much the peripheral vascular function like you get with arginine, and you're really not doing much as far as energetics, myocardial energetics. Okay, and that's if you really look at the additional supplements in addition to basically fish oil and green lip mussel oil in this supplement. What we're really looking for is additional anti-inflammation, and very importantly, and to me, probably the most important, is the cardiac energetics that we're trying to address. So, CardioCaps, obviously.
Got it. Okay. The next question, I can take this one. Where do I get CardioCaps? CardioCaps will be available on drfossums.com. They will be available within the next 30 days, if not sooner. So if you're looking to get notified when they come out, please shoot me an email, and I'll put my direct email in the chat, and I'll be sure to reach out to you when they come out. The dosing will be very specific on the side of the container, but typically it's going to be a number of capsules per twice a day per the size of the dog, and that will have that out as well. But it's probably going to be one capsule in the morning and one capsule in the evening for your dog. So and again, the CardioCaps will be released soon. We're just waiting on some final testing on that. Okay, so we have another question. Sir, please tell about a cardiorenal disorder.
Well, that's a pretty in-depth discussion, and probably well past this. Unfortunately, well past. I might reach out to. I assume it's Dr. Sharma. I might reach out to Dr. Sharma and maybe talk offline about that because that's way into the weeds as far as management. But I'd be happy to get into an offline. That's not something that's happening in the next 3 minutes.
Yeah, no, of course.
Yeah.
And we do have, on these webinars, we do have veterinarians that join as well as pet owners, even though it's, specifically set up for pet owners. And that just kind of shows you when Dr. Miller speaks, veterinarians listen, and that's it's very special that they're able to join. So Dr. Sharma, if you want to, my email is above. If you want to shoot me an email, I can do my best to connect and get questions answered for through Dr. Miller as well. Dr. Miller, Dr. Fossum, thank you so much.
You're
Yeah,
welcome.
Dr. Miller, thank you.
You're welcome.
Great job.
Happy to do that.